Okay, thank you very much for being here. I know this was a short notice that was called. Again, to each and every one of you that are here and to the viewing audience, I wish you and your families good health, and I'm just going to remind you again that we will get through this together as one and for the better. My city team, my city cabinet heads, again, we continue to meet every morning and making sure with our contingency plans and being able to provide services for our residents and our business community, and also coordinating with any and all from the federal, state, local level, with our private partners, hospitals, etc. Three big things have come up today. The first being that our hospitals and to the frontline people, God bless them, Bay State, Mercy, Trinity, and our homeless providers have reached out to myself and to my staff, my point person, Health Commissioner Helen Carlton Harris. They are at dealing with crisis mode type situations, and they reached out for help and some direction for myself and my staff. In turn, this is a partnership, and working with Bay State and working with Mercy Hospital and working with our homeless providers. This pertains to the homeless population, which is very vulnerable. You will see as early as tonight, or I believe tomorrow morning, and that'll be under the auspices. Again, Helen will be the point person, but Pat Sullivan, you'll be seeing a MASH type tenting. Will be going up across from the Friends of the Homeless on Worthington Street. I want to thank Springfield Technical Community College for the use of that property, specifically President John Cook, as we continue to work in partnership. This will now become a triage and holding area pertaining to the homeless population to give some relief to Bay State and Mercy, and we are working all facets of it. Pat Sullivan will explain a little more, obviously. Helen, I'll bring Helen up after on all the aspects and the partnership here, but the city will once again step up, and we will create this tenting medical environment with the safety proponents and the security. Excuse me, it's like what all of us, been long days and nights, in partnership with the medical community and our homeless providers. We have to be cognizant this is a very vulnerable population, and we have to make sure that, as we've done before, they're properly treated, and we're able to make sure that we're able to contain and isolate any situations that might arise. So shortly I'll have Helen and Pat Sullivan come up to speak on that. Two, I've already put the request in. First of all, our brave men and women in blue for the Springfield Police Department are doing yeoman work. Law and order continues here in the city of Springfield, and also in a compassionate way. I am not surprised. I was hoping it was so. But Commissioner Clapper will address that a number of officers continue to be taken away from the public to be checked if they're coming down with the COVID-19 or coronavirus. In turn, I've already put the request in to MEMA, Governor Baker and Pat Carnevale of MEMA, to request 75 National Guardsmen and women to come to the city of Springfield as early as late next week. Right now, Commissioner Clapper and the team are doing a tremendous job, but the numbers are starting to dwindle. I think we're possibly down 19 or 20 now. We have to prepare, be proactive on it. We did this during the June 1st, 2011 tornado. At the time, it was general Smith and Commissioner William Fitchett. It was really never done before, but we had armed National Guard under the supervision of Commissioner William Fitchett. And now with General Keefe, that's what I'll look to do with the armed National Guard under the supervision of Police Commissioner Cheryl Clapper. It was a fantastic partnership, and I'm sure it will be that way again. That does not preclude me from using these National Guard members pertaining to our homeless situation that we're setting up, or any other situations that come before us that would render the use. So that call has gone in. We don't want to wait till the last minute. And to any and all those, and I've spoken to a couple of the officers too, to wish them good health and speedy recovery and encouragement to them and their families. Third, and Tim Sheehan, my Chief Development Officer, is here. We fired off a letter, I don't remember the days anymore, Tim, but to HUD, the Regional Administrator David Tilley, and we're working with Congressman Neal, Chairman Neal, to see if we can free up about another $500,000, $500,000 unencumbered on CDBG funds to continue to extend not only the restaurant fund, but a small business fund. And this would be now unlike on the federal or state level, this would be a grant, not a loan. We want to try to bring immediate assistance to our restaurants and small businesses, whether it's a takeout now or small business, that they can keep their employees going and be ready once we defeat, and we will defeat this COVID-19 coronavirus, be ready to rock and roll again. So those are the three big announcements. We did not want to wait until Monday. Monday, again, we will be having our usual 10:15 press conference with all my cabinet head updates and with the president and CEO of Bay State Medical Center, Dr. Mark Kerouac, and of course the Chief Medical Officer of Mercy Trinity, Dr. Robert Ruse. With that, let me move away and let me bring up the Commissioner of Health and Human Services, Helen Colton Harris, and she will expound on this overall homeless, being proactive partnership attack with the hospitals, our homeless providers, and the city of Springfield. Health and Human Services Commissioner Helen Colton Harris.
Thank you, Mayor Sarno, and I am so appreciative of your leadership. To ensure that homeless have access to clinically appropriate, secure, documented medical assistance in a safe environment, the mayor has taken the extraordinary step of ordering tents in order to comply. Such care will be delivered in accordance with regulations promulgated by federal and state authorities and documented to assure compliance with professional standards. We are assuring through this process that we have 3 tents that will be put up on the site. The first tent will be used for testing for individuals. Now, I want to say right now, getting test kits are very, very difficult. And so, but we are going to have a place that we can test on site. The second tent would be for individuals who have symptoms and are needing to be isolated from the general population. And so they will be in an environment that is a tent. The third tent will be used for individuals who need isolation and quarantine. And so those are the 3 areas that we will use the tent for. We are in collaboration with Mercy Medical Center, homeless providers, as well as Bay State Medical Center. I will be on a call with them at 4 o'clock to talk about our infrastructure, our staffing. Those decisions are not concrete as I speak, The mayor felt that it was important that we move on this extremely quickly. He was very direct in his call with the providers. He expressed in no uncertain terms the urgency of this to our city to assure that our homeless population has the ability to be isolated and treated in the environment is necessary. The mayor has already thanked Springfield Technical Community College. I'd like to echo that, because we cannot get through this without the partnerships of those individuals that we work with on a daily basis, and we're very grateful for their partnerships. If we are to overcome this, we will need our partners. I'm going to end, and I'll give you some more data on Monday, but I again want to just simply say to these individuals under the age of 60, your numbers are growing. And so yesterday, I had 1,291 individuals who tested positive under the age of 60. As I stand here with yesterday's numbers, it was 1,332. So as you can see, individuals under the age of 60, we've asked you to be careful. We've asked you to do social distancing, stay home if you're sick, stay out of congregate areas. We've asked you to do that. And that is our expectation if we are to save lives. Let me say that the over 60 individuals at this point is 681. We are at the tip of the iceberg with this virus. Let's be clear, that is just the beginning. And so I'm grateful to have the leadership of Mayor Sarno. I am grateful for our partners across the city of Springfield and the Western region. Thank you.
Thank you. We'll take questions after. I want to again thank Commissioner of Health and Human Services, Helen Carlton-Harris. She has done yeoman work, and to my team, my whole internal team. I know my Chief of Staff, Tommy Ash, is here, and Director of Communications, Billy Baker, my money man, our CAFO, TJ Plant, who's tracking all the costs here, and my solicitor, Ed Pakula. Let me explain on the homelessness population, which is, again, very vulnerable. I'm going to bring up Pat Sullivan. He'll explain the physical plant of this. When people are diagnosed, and Commissioner Helen Carlton-Harris mentioned about those numbers, those were the state numbers we received earlier this morning. And be cognizant of under 60, and there's an increase in that 20 to 40 age range and 19 and under. I'll say, I believe as of this morning, because people always ask Springfield, I believe there were 10 in Springfield, and the number in Hampden County is much more than that. When you're tested, and I have looked at every nook and cranny, from the federal level, state level, local, even private vendors. And I appreciate the efforts of Governor Baker. I spoke with him again yesterday, and Lieutenant Governor Polito a couple times today, and Congressman Neal on the federal level, and I voiced this to Senator Warren and Senator Markey. We need the cavalry. My frontline people, besides the hospitals, reach out to me. N95 masks. We don't have enough. Testing. We're ready to go mobile. We don't have enough. We need these ASAP. So everything has to be done from the federal level on down. With the homeless, if someone's told that you have it, or you need to be quarantined, or you need to be secluded, or you need to go home, they don't have anywhere to go. If they're sent back to the Friends of the Homeless or any other shelters, God forbid that could spread like wildfire. In turn, and we're very highly commended on what we do for our homeless population, Springfield, but we end up taking the region at times. Many a time, the homeless are out there, which means they could run into you, friend, anyone. And plus, it's the right thing to do. So we're not going to wait and be overwhelmed with a tsunami and all of a sudden a spike occurs. We're going to be very, very proactive in moving on this. Now, Pat Sullivan, my directors of Parks and the Facilities Management, I always call him the Wizard of Oz. This tenting procedures, it's amazing. These are like MASH tents that are going to be going up, and the people that we're going to be dealing with putting it up. It's amazing what they can do. And he'll explain, give you some type of the what the tent has and the layout inspections from there. But we wanted to let you know because they could go up as early as tonight, definitely by tomorrow morning. Director of Facilities and Parks, Pat Sullivan.
Thank you, Mayor. Under the direction of Mayor Sarno and the Commissioner of Health and Human Services, Helen Colton, the Department of Parks Buildings will begin the install of 3 tents on the Worthington Street property across from the Friends of the Homeless tomorrow at 8:30 a.m. There will be 2 tents will be roughly 40 feet by 135 feet, and the testing tent will be approximately 20 feet by 40 feet. Those will go up over the weekend. On Monday, we have 2 3-stall shower bathroom units being delivered to the location, so that will be a total of 6 stalls. And hopefully by Monday at noontime, the temporary floors will be installed, which will start Monday at noon and go through Tuesday afternoon. It is our goal to have operational by Wednesday morning, and that will be depending on the weather conditions that we'll be working through probably on Sunday and Tuesday. I want to commend the mayor and Helen for taking this action. It's been a long week to get to this point. I also want to thank the Chief of Staff, Tom Ash, TJ Plant. I was on the phone with him till 10:30 last night going over numbers, and Tim Sheehan, the city's Economic Development Director, and Commissioner Cheryl Clapprood for their support during this process. Thank you.
Thank you, Pat, very much. Thanks, Pat, very, very much. Appreciate that. And again, for whoever's watching this, from the president on down, please, please, I urge you, and to the private manufacturers that are out there, and everybody wants everybody to make a dollar. I respect that and I get that. We have to defeat this COVID-19 coronavirus. We need all hands on deck. Please, anybody watching this, I need N95 masks ASAP. I need testing ASAP. Not only for my frontline and city individuals and PPEs, but for the hospitals. For the hospitals. All hands on deck. All hands on deck. We know what to do. We've been through a number of natural man-made disasters. We're going. We're going night and day. We need the supplies. We need the materials. We need to help our medical community, and they're doing God's work, as are the homeless providers here. Please, supplies that, and volunteers, volunteers who can help out, and even volunteers and retirees with the proper background credential on that. So now, on the National Guard, and again, I can't say enough about what our brave men and women in blue are doing, and our firefighters. Commissioner Calvi, B.J. Calvi, Bernard Calvi, they're holding on right now, but we might have to take a look at that, the brave work they do. But in our routine early morning meetings, Commissioner Clapprood has alluded to that the numbers are starting to increase of police officers that can no longer be on the streets right now. So, in partnership with the state, the National Guard, and MEMA and Governor Baker, I have requested a call-up of 75 National Guard men and women to come to the city of Springfield to supplement our Springfield Police Department and any other operations that we see fit. This would be under the supervision, direction of Commissioner Cheryl Clapprood, or try to mirror it as I did back in 2011 with Commissioner Fitchett during the tornado days, under General Smith, and now with General Keefe. These will be armed National Guard men and women moving forward. Commissioner Clapper will also allude to other strategies she is looking to use with academies and other things, but she'll look you straight in the eye, as I will right now. It is law and order in the city of Springfield. We will be compassionate, but rest assured that we want to make sure we keep our residents and our business community safe. Without further ado, our Police Commissioner Cheryl Clapper.
Thank you, Mayor. Good afternoon. As of today, the Springfield Police Department is able to man all the patrols, all the sectors, answer all the calls for 911 emergencies, and do all the investigations. However, in the last few days, I will tell you that we have about 20 officers that are either a dozen are about waiting test results. I have a few officers who are self-quarantined because they have come into contact with someone who is sick. I have one positive test that came back. He is doing fine. He's recovering at home. And I have some officers who have other medical issues, and their doctors are advising them to stay home at this time. So it's 20 right now, and I'd rather stand in front of you now and say, today I am fine and we can cover everything asked of us. But I'm willing to ask for the help now than to stand in front of you next week and say, I wish I told the mayor I could use some help, because it would probably be too late next week because everybody's going to be asking for the same thing. So I thank the mayor, and I understand the concept of being proactive, because sometimes if you don't take that step, you find yourself caught short. As I have said before, and I continue to say, under these trying times, when we're asking people to stay home, we're asking people to close their business, we're asking people to trust that the police department will be able to keep your businesses and buildings secure during this time when you're not there. We're relocating segments of the population, and we're asking them, don't worry, it'll be okay. You can stay in this tent for now and we'll take care of you. If I'm counting on that, I need them to have a sense of calmness and a sense of trust that I do have their back as far as security is concerned. And the only way I can do that is to make sure I have the manpower for the security. And the additional call up now for the National Guard will help me do that. It's not something I need today, but it could be something I need a week from now or 10 days from now, and I'd like to have them on board. I was around during the tornado. I worked out in the street with the National Guard when they came in and assisted us. It's a great working relationship. They are there simply to help us, and they come in handy. They'll do anything that's asked of them. Their appearance sometimes can be a calming sense, and the way that they handle themselves, they're trained well, and they're just an added sense of security for us. So I agree with the mayor. I'd rather say yes now than be saying to you at some future date, I wish we had them. It's a good working relationship. The police officers and the guardsmen get along fine. And if I have added locations that we are to protect, I'm going to need a little bit more manpower for next week and maybe the weeks to come. So it's a decision, Mayor, I agree with. I welcome them. I welcome them into the city next week. But please know, for the residents of Springfield, the police department is right now well equipped to handle your emergency phone calls, your emergency calls for service, to investigate all cases that come our way, to protect your businesses and your homes so that you feel secure during this uncertain time. And as I'll echo, we need the N95 masks, and I thank those people who came to the station yesterday, people who have retired and they were in construction. One was an inspector. They dropped off N95 masks. It was greatly appreciated. Thank you. Thank you, Mayor.
Thank you, Commissioner Clapper. Mr. Clapper's been a great leader. She continues to think outside the box. Again, she's exploring opportunities to move out the academy ASAP. We have great partnership with Sheriff Nick Cochi. That possibly there could be some help there when it comes to other ancillary type things, homeless or other things that we might use there. So we're making all these contingency plans as a fallback on that. To the business of business, and again, you know, the city's in the business to make business flourish, and we're doing pretty well, and we will do well again. And Tim Sheehan has been very good and innovative in finding monies. We already put out the Prime the Pump fund for our small, for the restaurants. Many that are still open, and please patronize your favorite restaurants. A lot of them are doing the takeout, and they'd love to see you. So we're able to free up some unencumbered money, about 225 or maybe a little south of that. And I think applications still be coming in till 5 o'clock today, and we'll be trying to get that money out, hopefully by the end of the month. But in turn, Tim and I were speaking about how can we get our hands on some more money ASAP, not only for the restaurants, but for the small businesses. And again, that letter went out to HUD. David Tilley, who's the regional administrator, good guy. We met a number of times. And we're working with Congressman Neal. We're hoping to free up another $500,000, $500,000 ASAP to continue this fund and expand it to the small business community too. So without further ado, my Chief Development Officer, Tim Sheehan.
Thank you, Mayor. As the Mayor referenced, the restaurant fund applications are due today at 5 o'clock. The Mayor announced that fund a week ago this past Wednesday. The city is trying as fast as it can to respond to the economic needs of our small business community. When we announced that, we recognized that it was limited to restaurants who were really the first impact of the emergency orders. But as the emergency orders expanded, we certainly knew that the need was going to expand as well. We immediately began looking at available funds that and reprogramming funds. And in working with HUD and Chairman Neal's office, we believe that we've identified a pool of funding for approximately $500,000. We will be putting together the criteria for a program that is broader in nature than just the restaurants, that addresses the needs of the small business community. I would anticipate within a week we should have program guidelines ready for the public. Thank you.
Thanks, Tim. And again, I appreciate Chief Development Officer Sheehan, Timmy's efforts on this. This again would be a grant. Would be a grant. I know some of the things that are being offered, and we urge those businesses also to look on a federal and state level. I know many are very, very low interest loans. Some, I believe, on a federal level. I know Eddie Pakula and TJ are going through the legislation, which we're hopeful passes in the House today, with the small print that some could be forgivable on the Fed side, but what we're going to do on the city side, this would be a grant. We're going to continue on to bring relief. At this point in time, I will step aside to take any questions of myself, or probably more importantly, my experts who are here, whether Health and Human Services Commissioner Helen Carlton Harris, Springfield Police Commissioner Cheryl Clapbrood, Facilities and Parks Director Pat Sullivan, or my Chief Development Officer, Tim Sheehan.
I'm confused about the locations for these tents. You mentioned Friends of the Homeless, but you also mentioned Springfield Technical Community College. So is it...
Springfield Technical Community College has parking lots across the way there. Those were once city property. They reached out to me, I think a couple of years ago, and said, Mayor, we need more parking for our expanding campus and educational hub. So we worked out a deal with them. So they took over or bought those properties. So they're directly, it's right across from the Friends of the Homeless on Worthing Street. So there's no educational aspect there. It is a parking lot. And again, I really want to thank President John Cook, a good guy and a good friend. He didn't hesitate at all. And their board of trustees for allowing us. We're on uncharted times right now, and we're all teaming together. So that's how that came to, and logistically, it made 110% sense to do it there. You're right there. Transportation, which we're working out with Bay State and Mercy, and I believe we'll probably have I know Tommy, my chief of staff, asked an AMR component, so that might be, I believe that's the way that could go there. We have other opportunities, options also. And then again, we'll let the medical specialists, hospital specialists, homeless providers, those, the company that we'll use, that will set this whole thing up, and Helen Carlton Harris and Pat will, oversee what, needs are, but they'll take care of the service type thing. We'll take care of the, we're fronting for the, thank you TJ, on these very specific type tenting opportunities, security aspects with Police Commissioner Cheryl Clapwood and/or National Guard or the entities on that. So that's where that site is. Yes, Captain Hook.
I've got a question actually for yourself or Commissioner Clapwood, if that's
Sure.
okay, about the 20 officers that are now off duty.
I'll have the Commissioner address that.
20 officers that are off duty, is this a higher number than you were expecting at this point of this pandemic, or is this is it higher maybe because of the lack of masks or gloves?
I don't think it's higher because of the lack of N95 masks, because we have been taking some pretty good precautions. I think it's probably what is expected, and I do expect it to rise because of the nature of the work. I think it was inevitable. We're out there, we're on the front line, we're coming in contact with people. There are some that I didn't expect, like the ones that had to self-quarantine because they had family members that traveled, or they have family members who are, one, for example, has a family member who's a nurse, and she had symptoms, so then he has to quarantine. And then a couple surprised me with their doctors giving them advice on don't come in to work. So I expect the number to go up. And the problem is the results of, I have a dozen officers who were tested earlier in the week, and they're in a holding pattern because I don't have the test results. So I'm waiting for those results. I don't dare let them back to work before, first of all, they're healthy, and second of all, I know for sure that they're not contagious with the COVID. So it's things like that starting to pile up. I'm sure it's going to get worse before it gets better, so I'm just better off prepared than I am screaming that I need help.
And just to follow up on this, with the 12 officers that are waiting for tests, are you able to rush these tests through to get these officers back out on the streets?
I bug everybody every day, so I can't rush other than going to some lab and saying, hey, what's going on? I've been trying to get the results back, but it's still a 5 or 6 day wait, unfortunately.
And, sorry, just with the National Guard, I need being a former soldier myself, there's a huge difference between
Thank you for your service.
soldier. Are you sending, when they're coming out on patrols, is it going to be a Springfield police officer and a National Guard?
That's the way we did it in the tornado, and that's the way I envision it now, Doug. Yeah, we had a supervisor with a few National Guardsmen, and whether it was simply patrolling to keep the break and enterings or vandalism down, or whether it's to keep people just feeling safe. If I have a few National Guardsmen at some of these tents with a Springfield police supervisor, I think they feel a lot better that the tent is a secure place for them to be.
Sorry. I know you said that people feel comforted when they see the National Guard. Certainly that was the case back in the time of the tornado. But I mean, right now, if you go on the certain social media areas, you're going to see all kinds of stories about, martial law being imminent.
That's why I don't go on those
But
social.
I understand that, but there are a lot of people out there, these rumors run rampant. That there's going to be a lockdown, they're going to close the borders, this, that, everything else. I mean, do you think that the sight of National Guard people in Springfield is going to upset some people at this point?
I would hope not, Paul, but if that's the feeling you first get, hopefully by our actions and their actions, we put those feelings aside. That's certainly not what's going to be relayed from me to them or from my officers to them.
Let me tell you, okay? When we utilized the National Guard during the tornado, they did everything from debris removal, traffic control, homelessness in a Mass Mutual Center, Helen, we had them there, to those patrols. And again, I know this, you know, I consider these, and you, Doug, you're a military veteran. I consider our policemen and women and our military personnel sentinels of peace. They are not out there, going out there looking for trouble. They're out there to keep the peace and help people of all residents of all creed, colors, and background, and businesses. I'll let you know when some of the other areas during the tornado had trouble controlling, looting was going on. She'll tell you less. You can count on one hand any incidents that we had on it. So when it comes to public safety, I'm old school. It's law and order, but we have a compassionate side too. You know, this is unprecedented what is occurring, and Helen talks about it all the time. There's a mental health component here. People, you know, we have to deal with that too. And these officers, police officers, they're trained in this. They're not looking for trouble. They're making sure everybody can live their lives in a respectful manner. Commissioner Clapper was right. Do you wait until the last minute and go, geez, I'm down 35 now? You know everybody and their mother is putting in requests to Governor Baker now. I wanted to make sure I was at the front of the line doing that. Matter of fact, on his press conference, which we watched in our cabinet room, I did send word to him. He talked about the airports. We did send word to him about Bradley International Airport. That is the hub of activity for Western Massachusetts coming forward. So people can harken back to the tornado days, and there was no issues whatsoever. And I would take these rumors and innuendos, and shame on these people that they spread fear on it, when we should all be, and the majority of people are, coming together as one to get through this. Instead of spreading that fear, take the time to check on your neighbor. Take the time to check on that senior citizen. You see, with some that want to spread these rumors, they do that for themselves. They do that for themselves. And that is very selfish on it. So, as I've said before and I'll turn it back to Commissioner Clapper, when we come before you, we're going to be proactive. We're going to tell you what has happened and what hasn't happened. But I'll turn it back to Commissioner Clapper.
I meet with command staff too every day, and I meet here at 9:30 with the mayor and my fellow department heads and cabinet heads, get all the information, and then I go back to the station and I meet with everyone who's in charge of a bureau or division on a conference call with those who are now scheduled and working from a remote area, so that my message is clear to everyone. I see us as a sense of calmness for the community, and to do good work and to let the community know that we are there for them. We are the exact opposite of taking over or being a Gestapo type of military aspect here. The only way to get compliance and to get people to obey these orders is to get them to trust you, and the only way they're going to trust you is if they know you're doing things for the right reasons.
We just want to let you know, too, some of our hotel people have stepped up to the Marriott or Tower Square, La Quinta, Hamden Inn, the ownership there of an initiative. We have contingency plans for many of our first responders that they might not be able to go back home. And that contingency plan is in place also with it right out the storm. But I'll tell you what, from the federal level on down, and I'm hopeful. I think next week they're testing, some testing breakthroughs could happen where you could turn them around quicker. But it's got to get better. It's got to get better with this testing. We're waiting way too long. We don't have enough test kits. The N95 masks, the PPEs, it's got to be all hands on deck. So And I also think there's been some stories of doctors or others that, and again, they're doing God's work, that are buying stuff really off the black market, and they should be gone. Whoever's doing that, whether from the federal, state level, they should be gone after for what they're doing, on price gouging or hoarding, all that stuff. And they should be thinking about themselves or their family members if themselves or their family members come down with this COVID-19 and coronavirus on it. But we will get through this. We will get through this. And Helen says it all the time. I know it might sound common sense or very simple in nature. Doing all the prerequisite health stuff, wash your hands, keep the social distancing going. If you don't feel good, stay home. Doing these things here. The more we do this, the quicker we're going to be able to get back on our feet, fully get back to work, fully get back to school, fully functioning with the economy. So I know it's sacrifice right now, but we need to do it. So I don't know if you have any questions, but again, the three big things, we're being proactive to deal positively with our homeless population and working in conjunction with our hospitals, Bay State Medical Center and Mercy Hospital and our homeless care providers with city partnership. We're being proactive, and I'm going to get to the head of the line to supplement our brave and dedicated men and women in blue with the National Guard, much as we did during the tornado days. That doesn't preclude me for using the National Guard for other things. We also have a fallback of Sheriff Cochise crew too, if needed, on some other ancillary type aspects. And three, we hear you loud and clear. We're hoping to get that influx of $500,000 shortly from HUD, CDBG funds, to get out, do another round. It'll be a second round to prime the pump, not only for restaurants, but for small businesses. So I deeply appreciate with the media, you're putting yourselves out here too, what you're doing to get this information out. And I can't say enough about my city team. Tested and true. Tested and true. And also to their families and my family, who have had to sacrifice like each and every one of you are doing. Yes, Doug.
So prime the pump, the first round's already come out. The second round is greater than 500,000.
Yes. So that'll be $750,000, nearly $750,000 that the city itself has gotten out there on grants.
One thing that some of the local business owners have actually said to me is, how long can this go on for once they get the grants? I mean, from their stage stories,
Yeah.
they don't know how long people are going to be kept away. They're reporting 75% losses of income.
It's not my call, but here's the thing. Here's the thing, and I think I've said it in a lot of my correspondence. And we will have a safe and healthy environment, we'll bring back that sense of normalcy ASAP. But again, a lot of that flows on the federal level. A lot of it actually flows on the state level with the governors and mayors. But I'm going to follow the facts. I'm going to follow the medical experts. And if they give us a go, that we're ready to come back roaring, I'll be the first in line. But you can't, I'm not an expert on these things. You got to follow the experts. You can't jump the gun that quick. Because if you do, and you get out there too quick, and then you take another shot, so patience. As soon as we get the clearance from federal or state or my local people that we are it is a fully healthy and safe environment, a sense of normalcy will come back. I'll call it right back just like that. But I really, we want to be prudent, which we have. We're taking this seriously. And I'm also trying to tamp down hysteria too. But a lot of, you're going to see the numbers go up because we're doing a lot of testing now. So those numbers are going to go up. And I think Helen made a good point. She gives us the figures every morning, or if something's up in the middle of the night, early morning. in the beginning, everybody was saying this was really affecting older senior citizens, 70, 80 years old with underlying medical conditions, and a lot of the deaths, God rest their souls, and to their families, God bless their families, they passed away to heaven. But you're starting to see now, and that's why the young people have to take this serious. That's why I told Pat Sullivan, it might seem simple, take the hoops down. No congregating going on anymore now. The playgrounds now are going to be all taped off. But you're starting to see even 19 and under, you've seen something there. Now again, they might have underlying conditions, I know, but you're starting to see that 20 to 40 range numbers, 60 and under numbers on it. So we got to knock down that curve. You know, we're at the point now of the tracing that has to occur, or mitigation trade, but then we really have to, once that has come down, the isolation of those individuals on it. So, but it's a delicate balance because you want to move the economy along, but at what? If you move too quickly, it's going to cost even more. I understand on the federal level, in conversations with Chairman Neal, Richie Neal, and I think that this is a first wave of support coming from the federal level, and this is like maybe a shot in the arm type thing to keep people who are going paycheck to paycheck moving forward. I wouldn't be surprised if you see a second type stimulus plan. This is not a stimulus plan now. This is something that extraordinary being done. And then you might have to, I know they've mentioned about the Marshall Plan after World War II. You might have to look at that. So you set that direction, you hit your spots, that self-confidence comes roaring back, and we move forward. Right now, you can't mix apples and oranges. Right now, the number one goal is to starve and kill this virus on it. So I think we're taking a lead on a lot of other things you would expect the state or federal government taking a lead. But please, I'm going to say it to you again. N95 masks. We need them yesterday. PPEs. Testing. The availability of testing and quick turnaround of those testing results. We need them yesterday. All working together, though, we are going to get through this as one and for the better. I promise you. I promise you.
Can you clarify the difference between tent 2 and tent 3?
Yep. Commissioner. Doesn't she look sharp as usual?
So I said to you that tent 2 was for individuals who might have symptoms, and we want to get them away from the general population. Tent 3 would be for individuals who require isolation and quarantine.
So those who have already tested positive?
Yes, those who have tested positive would be in tent 3.
And is there a timeline right now for how long those tents might be up? Or is it just indefinite?
The City of Springfield, the mayor has instructed us to keep those tents in place as long as necessary to keep the population healthy. And so the tents will stay up until we feel, from a clinical perspective, and have been advised by the medical experts that it is safe to take those tents down.
Helen, before you go, has anyone at Friends of the Homeless, or I don't know if the rescue mission is open this time of year, but has anyone there tested positive that you're aware of?
That address, and when positives come in, they come in by addresses and a number. That address has not been among the addresses that we're following currently. And we are doing contact tracing for all of the addresses that we have.
And we've talked, Ron Willoughby's been involved. He said he's all set for right now to handle any situation. I also want to thank, I mentioned, I know you need the college, AIC, Vince Miniacci, Mary Beth Cooper, Springfield College. They've reached out to if we need any assistance. And I also want to thank, and Cheryl, I know I'm going to forget, there's been a number of restaurants that have stepped forward to send food to our frontline people too. And if I start going to it, I'm going to miss people, but to them, I want to thank them. Did you have for Helen at all?
Maybe it's just when these tents to be fully operational. There was mentioned they're going up tomorrow.
Pat?
Floors are being put in on Monday, and then showers, I think, on Monday as well.
So I will let Pat Sullivan talk about the logistics. I know that it's going to beginning to be constructed tomorrow and then into Saturday. However, let me also say the operation of the tents will be dependent on the 4 o'clock telephone call that I'm having with the medical systems because we need to work out a concrete staffing pattern, and that once that happens, that will facilitate also the opening of the tents. Patrick?
And will that be confirmed later on today once you have that conversation?
It is my expectation at the end of the phone call that we're having at 4 o'clock that I will be able to articulate a staffing pattern that makes sense from a clinical perspective as well as an operational perspective.
Thank you, Helen. Pat?
So we're working very quickly to do our best to have this operational by next Wednesday, and a lot will depend how much we can get done over this weekend. And as the commissioner has stated, you know, it will be ready hopefully when they have that first positive test. So that's what we're gearing for.
Thank you, Pat. Any other questions or comments? Again, thank you to the media. I deeply appreciate you all being here to continue to get this word out to our public. And I wish each and every one of you, too, and your families, good health, and to the viewing public here, the same to each and every one of you. We will get through this together as one and for the better. God bless you and God bless your families. Thank you.
Thank you, Mayor.